I'm Jennifer Clark for DMG TV2's Medical Minutes. On this episode, we tackle your spring allergies with Dr. Kurt Guerin. Podiatrist Dr. Adam Myers has some advice for taking care of your feet. And Union Hospital's Emergency Department Director, Dr. Nate Johnson, has a new way to treat stroke. It's all coming up on DMG TV2's Medical Minutes.
A nursing home or your own home, it's good to be home. So call Ember Complete Care for all of your home health needs. When you're recovering from illness or injury, our compassionate staff promotes healing in the most comfortable environment of all, your own home. For skilled nursing, physical therapy, wound care, and more, Ember Complete Care serves all of Tuscarawas, Coshocton, and Harrison counties. Call 800-462-0909. Ember Complete Care. It's good to be home.
For chronic sinusitis sufferers, the idea of going to the hospital for invasive surgery may deter them from getting help. But thanks to Dr. Kurt Guerin, ENT, those days are over. Dr. Guerin is the first ear, nose, and throat specialist in Northeast Ohio to regularly offer balloon sinuplasty right in the comfort of his own office in Dover.
Welcome back to DMG TV2's Medical Minutes. I'm Jennifer Clark, and with us today is Dr. Kurt Guerin. He is an ear, nose, and throat specialist. He has an office in Dover and really all over the area. Welcome to the show.
Thank you. Thanks for having me.
And we have you on ear, nose, and throat because we want to talk about allergies. Everybody seems to have them. They're allergic to one thing or they have a year-round problem with allergies. What does that mean when your patient has an allergy?
Well, allergies basically are when your body reacts to something foreign to it, something that it's not used to seeing or something that's not native to the body itself. Whether it be pollens in the air, whether it be your pets, dogs, things along those lines, whether it be simple things like dust, dust mites, foods. A lot of people even have food allergies.
So you can't eat wheat or drink milk or eggs, seafood, those things. How do you can stay away from those?
Correct. I mean, when it comes to food allergies, the best way to do it's avoidance. There's no real other therapy other than to avoid what you're allergic to.
Is that why some restaurants or even food labels will say, hey, this is made with peanut oil if you're allergic to peanuts?
Yes. That's the only way to really let people know what you're getting into. And even some of the things you'll say made in a plant that has peanuts exposed to it, because people who have those types of allergies have them so severe that they could be life-threatening if exposed to them, even just the oil on something else.
Wow, that's really sensitive.
It is.
So how do you know if you have an allergy or just an isolated reaction to something?
Well, if it's like a true allergy, if it's terms like the environment and things like that, what you're going to see is you're going to have those types of symptoms. You're going to have the nasal congestion, the itchy, watery eyes, the runny nose,
people are miserable.
Right. I mean, you'll see people that have swelling underneath their eyes. It'll look black. You'll see them kind of tipping their nose all the time. They'll be using tissues. And a lot of times it's going to be seasonal, so you'll kind of know when it's about to come on. So those are the types of things that you're going to know. It's symptomatically defined at first. And then if it becomes a problem that you need to continue to treat, a lot of times we'll go and test people. We'll do either allergy testing on the skin to look for different things in the air, pollens, and then we'll do some blood work or something like that if we want to test for foods.
I've heard of the patch testing where you have, I'm exaggerating, 50 patches on their back to test to see what they're allergic to because you don't know. What's that like?
Well, they've gotten a lot more sophisticated with it. In the old days, they used to use needles, and every single one was one individual needle stick. Nowadays, with what you're talking like in the patch testing, we call it a multi-test, and each one, there's like 8 little prongs on the back of a piece of plastic, and it just basically barely breaks the skin with the allergen on top of it, and we just kind of watch you react to it.
Is that the best way to figure out what you're allergic to?
It's not necessarily always the best way, but it's the easiest and simplest way.
When do you go see a doctor?
Well, what I always tell people is come see a doctor after the things that you can take over the counter have failed. There's plenty of antihistamines out there over the counter that work quite well for a lot of people to control their symptoms. I don't, in general, end up seeing the patients in my office until they've tried different things and they say, hey, this isn't getting any better. I need to see a specialist about this.
Yeah, but I have no patience for that. I've dealt with allergies with my children, and we keep trying one after another. It's really frustrating. Is there any quick answer?
I wish there was a quick answer. If it was a quick answer, I'd be out of a job, unfortunately. But more times than not, most people who have allergies do have pretty good control with just the over-the-counter medications, keeping in mind that the ones, like I said, that I see that come in are the ones that have failed the over-the-counter medications. In that case, a lot of times what we do, we take the history, kind of discuss different things. A lot of different simple medications we'll use. We use nasal steroid sprays to try and control the inflammation in the nose. Just like the over-the-counter antihistamines that you see, the Zyrtec, the Claret, and the Allegra, we have a little bit more potent ones that we write prescriptions for. We also have some nasal sprays that we can use that have antihistamines in them. And then if you keep going further like that, we have even more potent and stronger medications, some that will work with allergies as well as asthma that kind of combine, since we see a lot of patients that have both. And then if you keep failing all these medications, then we do get to the allergy testing, and then we talk about immunotherapy if it's appropriate, which is the allergy shots that people talk about.
Yeah, I've heard of those where these shots are supposed to last at least a few weeks. What happens if they don't? What happens? There's always that, oh, okay, this worked for a little while and now it doesn't work anymore.
Well, the true allergy shots, the immunotherapy that we're trying to take, where we take the allergens you're allergic to, start out in very, very low doses and kind of build it up inside your system. We start those out weekly. And what you're doing is you're actually introducing into the person's body, into their system, what they're allergic to kind of train the immune system, if you will, to not react to it. And those we do weekly, and they kind of build up over time, and you get to a point then that your body stops reacting to the allergens in the air that you're exposed to, and that's how those work. The shots that you're probably talking about are the Kenalog shots that everybody kind of brings up. Those aren't things we routinely do. Those are people who are very, very severe because they're steroids and there can be some side effects. Those supposedly last about 6 months. It seems like lately around here with the Tuscarawas Valley, the way it is, Sinus Valley.
I've heard that. We do live in Sinus Valley.
Yes, we do. I mean, it's kind of one of those things where we live, because of the way the river runs through it, the way the hills are around us, and actually part of just kind of the way the wind blows, is that a lot of the pollen kind of settles in here and it stays. So we catch a lot of other people's pollens and we don't share it with anybody else.
Oh, terrific. Now, can you develop an allergy later in life, or do you have it your whole?
It's very common to develop allergies later in life. The more you're exposed to something, whether it be in the environment, the pine trees, the oak trees, the grasses, the weeds, pets, animals, things like that, that your body can over time start to develop the sensitivity just from being exposed to it. So it's not uncommon for somebody, even in the middle of their life, to come in and say, geez, I never had allergy symptoms before, ever, and now I'm having them. And
one other quirky thing about allergies, you might be allergic to cats, but not to dogs. How are you only allergic to pollen or only allergic to animals? Why is that different? Each one has a very specific allergen or antigen inside of them. And so you can be allergic to one type of grass and no other grasses. And some of them will cross-react a little bit so that you might be allergic to this one and a couple other ones. But for the most part, when you start dealing with the separate proteins and the separate entities, they're all going to be different. So that's why we test for each one. When you said all the number that we put on is, when you talk about you could be allergic to cats, you could be allergic to dogs. I mean, we see people around here allergic to horses, rabbits, even guinea pigs. And they can be allergic to one or all of them, or, a mixture of them. And the only way to prevent it is to avoid it. Right. When it comes down to that, it's to avoid it. And in this area, the only way to really prevent true allergies is to live in a bubble or move. And we don't want people moving. And I've heard that too. Some people move to a more arid climate that's, there's less, but you can never really avoid it completely. Right, and even moving away from a climate that's high in allergens, if you have a high propensity to have allergies, if your body's built that way, if you will, then what happens when you move someplace else, you're going to end up eventually developing allergies to the new things you're exposed to. All right, well, we'll have to make sure that if you have an allergy, try everything you can, and if it really continues to be just terrible, then that's when you go see your doctor. Correct. All right, very good. Dr. Kurt Guerin, an ear, nose, and throat specialist based here in Dover, our guest here on DMG TV2's Medical Minutes, and I'm Jennifer Clark.
Looking for ways to get a return on your marketing investment? Get results with Digital Marketing Group. We provide a digital marketing solution with state-of-the-art opportunities to increase your visibility in the community, optimize your digital presence, and maximize your marketing investment. We specialize in affordable websites, custom mobile apps, search engine and social media optimization, high-definition video production, broadcast television. If it's digital, we develop it. If you're looking for a way to increase your profitability, obtain new customers, retain current customers, and get the return on your marketing investment, then go digital. Get results with Digital Marketing Group.
For chronic sinusitis sufferers, the idea of going to the hospital for invasive surgery may deter them from getting help. But thanks to Dr. Kurt Guerin, ENT, those days are over. Dr. Guerin is the first ear, nose, and throat specialist in Northeast Ohio to regularly offer balloon sinuplasty right in the comfort of his own office in Dover.
A nursing home or your own home, it's good to be home. So call Ember Complete Care for all of your home health needs. When you're recovering from illness or injury, our compassionate staff promotes healing in the most comfortable environment of all, your own home. For skilled nursing, physical therapy, wound care, and more, Ember Complete Care serves all of Tuscarawas, Coshocton, and Harrison counties. Call 800-462-0909. Ember Complete Care. It's good to be home.
Welcome back to DMG TV2's Medical Minutes. I'm Jennifer Clark, and in the studio this time around is Dr. Adam Myers. He's one of our local podiatrists. And tell us a little bit about what you do. When you say podiatrist, obviously you think of foot care.
Right. Within my practice, we handle anything related to the foot and ankle, from surgery to conservative care, ingrown toenails to ankle fractures.
So if I sprain my ankle, I want to come to you instead of running to the emergency room?
Yes.
And particularly problem area is for diabetics.
Correct.
So why is diabetes a problem for your feet?
Diabetics run into a large number of complications with their elevated blood sugars. On an annual basis, the number one reason diabetics get admitted to the hospital are complications with their feet. Diabetic ulcers, gangrene, amputations. Most of the early problems will show up in the feet when you start getting diabetic complications.
And diabetes, is there not enough blood flow to the feet, or does it get clogged and they can't get the blood to the toes?
Diabetic complications range from decreased circulation, and it seems to affect the blood vessels more between the knee and the ankle, and you get an increased rate of narrowing of the arteries, much faster than normal. If you smoke on top of that, it's even worse. In fact, diabetics who smoke are twice as likely to have amputations than those who don't. But it also affects the nerve function. Not only they get problems with getting blood flow down to their feet to keep them healthy and the skin as strong as it can be, they can lose feeling to where they don't know if they step on something or if a shoe's too tight and rubbing, and that can set them up for the opening in their skin. They don't feel it, it gets infected, they have poor blood flow, it doesn't want to heal, the antibiotics can't get there, and that's when they become at high risk for amputation.
It sounds like a disaster.
It can be.
And how do you treat that? How do you tell them, okay, pay attention to your feet?
It starts with education, and you have to convince them that this is a big deal, that the risk of amputation is real. The next main step is controlling their diabetes. If they can't keep their blood sugars down, whether family medicine or internal medicine, the endocrinologist want them, the complications are going to happen no matter what. After that, you try to educate to not smoke, to inspect their feet daily, to wear appropriate shoe gear, to avoid high-risk behaviors such as going barefoot. And it's really an education process because they have to do it day in and day out.
Well, that kind of goes for just anybody. It doesn't have to be a diabetic.
True.
But yeah, barefoot, that's pretty dangerous no matter where you are.
It can be, yes.
What's the most unusual thing that you've come across?
In related to diabetics, I don't know how unusual it is if you're in my field, but to the common person, I've had patients walk in with gangrenous toes that have been gangrene for days and weeks.
And they don't know it.
Well, it doesn't hurt, so they kind of choose to ignore it, hoping that it'll go away.
We're just all in denial, right?
Sometimes.
And when do you make that decision that you do have to amputate a toe or the entire foot?
It's a combination of how severe an infection might be coupled with their ability to heal. Some people, the infection is so advanced that the tissue is already dead and you have to get rid of it in order to actually prevent it from spreading and potentially taking more of their leg or even their life. Other cases, the infection isn't so severe, but the circulation is so poor that they just don't have the ability to heal, and their body becomes weaker because they keep fighting this battle they can't win. So you have to make the decision to remove that part of the foot or leg in order to help speed up the healing process.
And how often does this occur? Are these the most severe cases?
We are talking about the most severe cases. I work as well as my partners in the Wound Healing Center over at Union Hospital, and our amputation rate there with appropriate care is under 5% of the chronic wounds we see. It's not a daily or even a monthly occurrence in our practice, but sometimes there'll also be a stretch where in 6 weeks we'll have 4 or 5 amputations. So it varies, but they are the most extreme cases.
But diabetics with foot problems, that's pretty common, isn't it?
Diabetics with foot problems can be very common. All diabetics, no matter how well controlled they are or how newly diagnosed, need a foot exam at least once a year. If they have complications such as poor circulation, diminished sensation, bunions, hammer toes, they need to be evaluated more like every 6 months. It can be, I of course prefer a podiatrist, but it can be done by a well-educated nurse in a diabetic education situation. It can be done by the family doctor, but they need to be looked at by a medical professional on a regular basis, and they need to be inspecting their feet every day so that when they do, if and when they do lose sensation, they're not just counting on, well, my feet don't hurt, I must be fine, that they look down and see that cut or scratch and can get into a doctor's office and get it addressed in a timely fashion.
And do you find that most people, diabetic or not, just ignore their feet?
Yes.
They don't want to deal with it?
Most people don't pay any attention to their feet until they've had problems with their feet.
And is it worse in the summer, winter?
There is a seasonality to a lot of the foot problems we see. Tendonitis, things like that are more common in the summer. You might see a little more issues with people trying to go barefoot and in flip-flops in the summer, but then you have the slipping and falling in the winter and injuries that way, so it just varies.
And men versus women?
Not a real difference that
Really?
way.
Women wear high heels all the time.
They do, and the incidence of foot problems, as far as say bunions and hammer toes, I think is pretty much equal between the sexes. Women are a little more likely to come in and have problems because of their choices in footwear than men. But if you were just to count how many men and women have bunions, it's probably about equal.
So in all, just pay attention to your feet. And if you think you have any kind of a problem, obviously call your doctor.
Yes.
Very good. Well, Dr. Adam Myers, our local podiatrist here on DMG TV2's Medical Minutes, and I'm Jennifer Clark.
A nursing home or your own home, it's good to be home. So call Ember Complete Care for all of your home health needs. When you're recovering from illness or injury, our compassionate staff promotes healing in the most comfortable environment of all, your own home. For skilled nursing, physical therapy, wound care, and more, Ember Complete Care serves all of Tuscarawas, Coshocton, and Harrison counties. Call 800-462-0909. Ember Complete Care. It's good to be home.
For chronic sinusitis sufferers, the idea of going to the hospital for invasive surgery may deter them from getting help. But thanks to Dr. Kurt Guerin, ENT, those days are over. Dr. Guerin is the first ear, nose, and throat specialist in Northeast Ohio to regularly offer balloon sinuplasty right in the comfort of his own office in Dover.
Welcome back to DMG TV2's Medical Minutes. I'm Jennifer Clark, and in this segment we have Dr. Nate Johnson. He is the Emergency Department Director at Union Hospital, and today we have you on because we want you to tell us all about stroke. The condition of a stroke can be a variety of things. People may not recognize it, but it's one of those, I consider part of those heart disease problems that you really, really have to pay attention to. So what is a stroke?
Most of the time, classically, a stroke is a symptom or a neurologic deficit, I guess in complicated terms, that's caused typically by a clot in a specific portion of the brain. And it could be any portion of the brain, but usually it's it's one clot located in one location causing some classic symptoms that we recognize as stroke-type symptoms.
And if untreated, you'll die.
If it's a large enough clot in a large enough part of the brain, yes, you could die from it. There are 800,000 strokes per year in the United States. Of those, 130,000 people do die of the stroke. So most of the time they're not fatal. Unfortunately, most of the time or much of the time, they cause permanent disability, where people lose the use of one part of their body, whether it be an arm, a leg, or end up with communication difficulty because they slur their speech the rest of their lives. So yeah, you definitely, they can be lethal, but also they're terribly disabling.
And it happens pretty frequently in our area.
Oh, absolutely. We are, the United States Southeast has the highest concentration of strokes per year, but here in the Midwest we have a pretty good amount of them as well. It goes along with some lifestyle issues, diabetes, hypertension, obesity, smoking, and all of those things, unfortunately, are things that we see plenty of here.
And tell me a little bit about what happens to you when you're going through it. Your one side doesn't work anymore. Your arm falls off, not off, but your leg will. You lose that motion.
Typically, what first starts, most people tell you, is they just don't feel well, and then they'll notice that one arm or the other, maybe the arm, it may be the leg, goes numb or goes weak. They may be slurring their speech. In fact, often it's a family member that says, "Mom was just slurring her speech. She just started out of the blue."
Does one side of your face droop or anything? Is something that obvious?
It depends upon the part of the brain. Interestingly, often you will get a droop to your face and difficulty with speech, but sometimes you may not have a droop to your face. You just may have difficulty speaking because the part of your brain that forms words or understands language is not exactly the same that controls the muscles in your face, although they're very close. You may also get weakness or numbness in your leg. Some strokes are limited to the leg. Some strokes involve the leg and the hand. Some strokes involve the entire side of the body. Some strokes cause other symptoms such as dizziness, but those are a bit more rare. The classic symptoms are numbness or weakness on one side of the body, and again, it may be limited to one part of one side of the body.
So what do you do to treat it?
Well, a lot of it depends upon timing. Right now, the primary treatment, timing allowed, is what we call thrombolytics. And thrombolytics it's a drug that basically thins your blood. It breaks down almost every clot in your body that may be present at any one time. They're incredibly potent. They have to be used within a certain time period. Basically, you have to come to the hospital so that we can give you that drug within 3 hours of the onset of your symptoms of stroke. And it's very tightly controlled. Once you're out of the 3-hour window, the risk of giving you that drug increases. And that risk is, if you get it late, and sometimes, unfortunately, if you get it on time, it can cause bleeding into the brain. And the reason being, that area of your brain that's not getting enough blood flow, the blood vessels in that area become somewhat weak, is the best way to put it. They're not doing their job. And so if you break that clot, and now there's blood in those blood vessels, they can leak some blood out. So we know that we need to get it within 3 hours. There have been some new studies within the past couple of years that say in a specific population, we can give that out to 4.5 hours. And we've got that tightly managed. We know exactly who those people are. There's a checklist that we go down. So I like to tell people, get there as soon as you can. Because frankly, if we're going to give it within 3 hours, there's work we got to do. We've got to draw blood work. We've got to do a very thorough neurologic examination. And we've got to get a CAT scan of your head that shows that there's no bleeding. Because if there's bleeding in the brain, we cannot give you that medication because the bleeding will worsen. So we've got to get this job done first. And then if we're still within the time period, you'll get that medication. And again, this goes back to our association with the Cleveland Clinic, because before you get that,
Right, that they help you. There's a kind of
absolutely,
a computer hookup with physicians up at the Cleveland Clinic.
it's really more of a robot. It's odd to say that it's a computer system where you're looking at a monitor, and there is on the other end of this monitor, sitting in what's the neuro-intensive care unit at the Cleveland Clinic, there is a neurointensivist, and this is usually a neurologist who is a world-class expert in stroke. And I just used this yesterday, and the gentleman on there came over and spoke with us, and basically my patient came in, and within about 5 minutes of seeing her, we contacted him. He was actually in the room on the computer waiting for her to come back from CAT scan, and the minute she came in, I introduced the two. He controls the screen. We have a nurse in the room with him. Usually I'm in the room as well, at least to some degree. And he examines this patient with the use of the nurse. And when it was done, he spoke with me and said, look, this particular patient, may or may not need thrombolytics. If we want to give thrombolytics, he orders it. He's on staff. He's officially on staff at Union Hospital. And he'll order it. And then what we decide if we give thrombolytics is what we do next. Do you stay at Union Hospital? Do you go to the Cleveland Clinic? If you're out of that 4.5 hour window, there are some options at the Cleveland Clinic to do. And in that case, usually what we'll do is we will fly you by helicopter up there. And they'll do what reminds a lot of people of a heart cath, where they'll go in through a blood vessel. They will sneak a wire up to where the clot is in your brain, and they can actually give the thrombolytics right there into that artery that's blocked.
Wow.
They don't do it with every patient, but a specific number of patients they will do that with. And occasionally, if that doesn't work, they can actually use a small device through that catheter and try to manually remove that clot.
So after your stroke, do you recover completely?
With the thrombolytics, and again, I wish I could show you the graph right now. Basically, the earlier in the stroke that you get the thrombolytics, the much better your chance of a full recovery. We've had 2 patients right now that we've given thrombolytics to in our program, and both of them have had significant, if not amazing, recoveries, almost completely back to normal.
But the whole point is to avoid the stroke in the first place.
It is. It is. And look, once it happens, you've got to get to us, because the problem is if you went to bed, if you were feeling ill, you had some numbness in your leg, and you went to bed, and you woke up in the morning and you're not better, that stroke started probably 8 hours ago, and there's not really much we can do. You've got to get in right away.
And you mentioned earlier, watch your cholesterol, watch your diet, watch your blood pressure, all kinds of things that...
Your blood sugar, if you're diabetic, that's another big issue.
And we've hit on these lifestyle changes for years and years. Do people actually follow them?
Yes, I do. And the people who don't sometimes get a fatalistic view where they say, oh, my grandfather said this, I'd rather be dead than be a non-smoker. So people make choices.
And always call your doctor for advice.
Yes, talk to your doctor, and unfortunately, one thing I have to tell you is if you got symptoms and your doctor's on the office, or even if he is, if you've got symptoms of a stroke, come to the emergency department, and come to the closest emergency department.
All right, very good, including Union Hospital's emergency department, where Dr. Nate Johnson is the director. Thank you so much for being on DMG TV2's Medical Minutes, and thanks to all our guests for this episode. For DMG TV2, I'm Jennifer Clark.